So, I'm Graham Moore. I'm based in Cardiff University, Professor of Social Science and Public Health. I'm going to be giving an overview of kind of developing a career in public health. And I don't know if I've slightly subverted the brief, because rather than talking just about my own individual career journey, I'm talking much more about kind of building a team and sustaining a team. Because actually, building a career does, I think, as you become more senior, become about kind of sustaining a team and building, bringing along the kind of next generation of people behind you. I had worried a little bit in putting these together that my text was going to be a little bit too small for the screen, because you never know whether you're going to get a little TV in a massive long room, or I think we're going to be okay, actually. So my background's in intervention science, interventions to improve public health and reduce inequalities. I might just stoop down a little bit because the microphone's a bit far away from me because I'm ridiculously tall. This is the main focus of the work we do in the Decipher Centre. So some of our work focuses on things like improving mental health in schools. We've got colleagues working with homeless centres to support smoking cessation. We're working on adaptation of dementia self-management programmes across countries and contexts. And good public health research is about kind of providing understandings of what works to enable populations to lead happier, healthier lives and to reduce inequalities. And lots of the evidence gaps that we're focused on are kind of around kind of how we develop, evaluate and implement effective and sustainable changes outside of kind of healthcare contexts. All domains have the potential to influence health. And the priorities can change quite rapidly in public health, and I need to stop kind of gesticulating because I'm not. The research questions are kind of shaped via funders will launch commission calls. I'm Deputy Chair of the NIHR's Public Health Research Committee, on that committee for the last 2 days, and lots of the bids that come in there are kind of responses to things that the funder has identified as priorities. Researchers often will obviously bring their own ideas to these funders as well, and lots of our kind of ideas come from collaborations with government representatives, organisations like Public Health Wales and the public. So the theme of the conference, People Make Research, just going to talk briefly about who some of the key stakeholders we need to engage with in public health research are. And one of the key challenges here is, I mean, public health, clues in the name, literally everyone is a stakeholder in public health, so it can be quite difficult to narrow it down to decide who to engage and who to involve. And often this will need to be quite tailored to the specific bit of public health that you're kind of focused on. So key stakeholders will include the public. That could be general population groups. So in Decipher, we often work with general population groups of young people. I'm also doing work at the moment around school-based interventions and mental health for autistic young people and young people with ADHD, so a kind of topic quite close to my heart. And we're doing lots of public involvement work with young people who are autistic or have ADHD. We've got a paper in hopefully the final stages of review at the moment, which has 14 authors on it, 12 of whom are either autistic or have ADHD themselves. We also work a lot with policymakers and practitioners, like I say, across health and non-health domains, because things that impact on health aren't just decided in the Department of Health. Things that happen in other departments will have potential to harm or improve health. We work a lot with third sector organisations and obviously other academics across lots of disciplines. I think that diversity of stakeholders in public health does mean we need to communicate effectively across lots of different groups. I think public health is also probably slightly unique in the care we need to take not to engage with certain groups. Tobacco industry being kind of the most obvious one. Lots of cases quite early in my career when I was invited by the BBC to do interviews, turned up and they had a guy from a tobacco industry funded lobby group to argue alongside me, and I was like, no, I'm just not doing this interview if you're going to do that. But there are lots of grey areas as well, lots of industries that some researchers will engage with, others won't. People take slightly different positions. So I think for me, an important skill in the area of research I work in is the ability to work across disciplinary boundaries within academia and beyond, kind of respect for differing perspectives, willingness to reach shared understandings of the nature of problems, the nature of potential solutions. It's very much a team science. We need to kind of value the diversity of kind of perspectives and contributions that kind of come to bear on public health research. And we also need to develop an understanding of and kind of respect for a diverse range of methodologies. I think in the 7 years I've been involved in the NIHR Public Health Research Committee, for example, it's very much shifted from a focus on funding mainly trials towards funding a much broader set of evaluative studies, lots of natural experiments, modelling studies. So the types of methods that are used in public health really evolve quite a lot over time. And also willingness to adapt and respond to change. So public health priorities can rise and fall rapidly. We might be able to identify some kind of changing priorities that occurred 2 or 3 years ago in public health. Okay. We've also seen from some of the major funders kind of increasing investment in sort of responsive infrastructures that kind of expect us to be able to do work that's kind of rapidly kind of responding to any kind of topic area, any kind of population, just applying kind of flexible methodological skills across those. I think lots of these skills can be learned formally, but also by kind of doing and being around other scientists and stakeholders who see the same issues from different perspectives. But just in terms of some of the success stories from our group over the last decade and a half, we've developed a school health research network which works across all secondary schools and many kind of primary schools in Wales. There's some BBC coverage of some of the work that's generated today around kind of young people's use of social media. And that's generated lots of data that's been used in sort of national evaluations, things like Tobacco Products Directive regulations, Welsh Government's whole school approach framework to mental health. We've done lots of work kind of shaping methodologies for how intervention science is done. So some of our kind of guidance around process evaluation, adapting interventions to new contexts is used really widely in lots of international contexts. And actually, I think the screen's probably so big, you could probably read the abstracts on those little screenshots. And obviously success also means kind of building a team who can sort of sustain and continue to evolve this work, kind of building capacity within your team across Wales, internationally. So success, I think you can often think of it as being about kind of discrete events, getting that grant funded, getting that paper, but it's also a process. So challenges, I mentioned the need for interdisciplinarity. Everyone's telling us we need to work in more interdisciplinary ways. It can be really difficult to do just because the kind of administrative challenges of bringing together work across departments in the same university, lots of different university, non-university stakeholders can make this challenging. We've got a grant at the moment that's 3 months delayed starting up because we were told that the grant had to involve work with industry. It does, and that has introduced administrative processes no one had encountered before, and it's taken months to get through those. Traditionally, lots of people will say to build a career, you need to move around from one place to another. That's not always possible. My wife is from the Merthyr Valley. We've got children here. I'd have a real hard time if I said that I was going to get a job in another city, persuading her to come with me, I think. So you have to make choices. I built my entire research career in Cardiff University, but there's been lots of other ways of engaging with teams outside of Cardiff, learning from how other people do things. So I think that kind of age-old view that you need to be moving constantly to keep progressing is quite problematic, I think, from a kind of equalities perspective. Obviously, one of the big challenges, some of the other speakers have talked about this already, securing kind of continuous flow of funding to build and maintain your team. Contract insecurity, how universities employ research staff obviously makes this really challenging. And once you do manage to get that permanent position, you'll find that the time that you can devote to research shrinks because you do need to take on quite a lot of teaching as well. And obviously, we need to kind of learn in building a career in any kind of scientific field, really, to take on board constructive criticism, deal with rejection, and accept the more random elements in success and failures. I think we all like to pretend that everything we've done well everything that's gone well for us is down to our own hard work. Sometimes it is just about being in the right place at the right time. So we got a huge amount of exposure a few years ago when e-cigarettes were just becoming a thing, because we published some of the first kind of papers on like nationally representative estimates of young people's use of e-cigarettes. Not the most methodologically complicated science I've ever been involved in, but it just came along at the right time and got a huge amount of exposure for the work we were doing. So just in terms of reflections and advice, and I've been given the 1-minute warning, so I will keep this to 1 minute. Research priorities in public health can change really rapidly. So you do need to be adaptable and willing to kind of, move between areas of research. There is no single path. Some people do pick a single kind of topic and build a programme around that, adapting flexibly to kind of how policy changes around that topic over time. Others apply a broad sort of methodological skill set across a diverse range of topics and populations. I think people progress and find success at different times and different rates as well. So it's worth kind of not rushing to get too far ahead, kind of taking time to learn the fundamentals by kind of working with and learning from others. And public health is really a team science, so you do need to start kind of building your networks early in Wales and beyond. You don't necessarily need to be moving around from one place to another, but you do need to be engaging with groups outside of your immediate circle. And it does require a lot of hard work, but it does also require some luck for the right opportunities to come along at the right time.